Hi, I'm back again today. If you don't know me, my name is Allie and I'm a PT with Lake Area Therapy Services. So we've been talking a lot about breathing exercises and respiratory health and how you can keep yourself healthy during this time. And today I specifically want to talk about the muscles that help us to breathe. More specifically, I want to talk about the muscles of inspiration, or the muscles that help us to get air in or help our lungs and diaphragm to expand. So there are a handful of muscles that help us to do this. The primary muscles of inspiration are your diaphragm, of course, and then muscles called the external intercostal muscles, which help to lift the rib cage up so that your ribs can expand in this nice three-dimensional way. Your ribs actually expand outward, upward, and front to back to allow your diaphragm and your lungs to fully inflate. The accessory muscles of inspiration are some smaller muscles in the front of your neck here. And so those are called the sternocleidomastoid muscle, or also known as the SCM, and your scalene muscles. So those muscles help to elevate the sternum and also to elevate the upper ribs and kind of fix them up there so that, again, everything can expand and allow for the lungs to totally inflate. So we want to keep these muscles nice and flexible so that as you take a nice deep breath in, those muscles have the flexibility and range of motion to move. The first stretch I want to show you, you're actually going to place one or both of your hands right along your collarbone here. So you're almost going to act as if you're trying to hold your collarbone down. You're not yanking on it, but just putting some nice steady pressure here. And then once you've got pressure there, you're going to tilt your ear or your head to the opposite side and then rotate your head to look up towards the ceiling. Now you should feel a nice gentle stretch along the side of your neck that you're holding your collarbone down. And while you're doing this, you want to keep your jaw closed. You don't want to have your jaw hanging open because you won't get as much of a stretch. And also, you want to continue to breathe. So as you're doing that, you should breathe in through your nose and out through your mouth. Keep your neck and shoulders relaxed while you're doing this stretch. It may be a little uncomfortable, but it should be tolerable and should not be painful. And ideally, you would want to hold this stretch for about 30 seconds. Once you're done, you would release your hands from your clavicle, and you could do the same thing on the opposite side. The next stretch, you need a prop. So you're going to use something like a dish towel, a strap, a belt. If you're somebody who wears a crossbody bag, as long as it's not too heavy, that also works well for these next two exercises. So you're going to take that strap or whatever you're using here and drape it over the shoulder that you want to stretch. You're going to grab the front on that same side, and then you're going to take your opposite hand, grab the end of the towel behind your back. Now, depending on how much shoulder range of motion you have, you might need to have something long. So a dish towel might be too short. You might need to find something longer, like a pillowcase or maybe even a belt. A dog leash could work, anything that doesn't have a whole lot of give to it. If you have those stretchy TheraBands that you've been given by a previous physical therapist, don't use those, they're too stretchy. All right, so you're going to put some pressure down through that side of your shoulder that you're stretching. And again, you're going to tilt your head away from that side and then turn to look up at the ceiling. Similar to the last exercise, you want to continue breathing in through your nose and out through your mouth. Keep your head and neck and shoulders relaxed. Keep your jaw closed. And after about 30 seconds, you'll return back to your starting position and switch sides. The second stretch, or the second exercise rather, I want to show you is also using the strap. You're going to use it in the same manner, but you're actually going to pull it across your body a little bit more. This is where something a little bit longer actually works a little bit better. So once it's across your body and before you put any pressure on it, you're just letting it rest gently here. You're going to bring your ear to the same side to kind of pick up the slack, then pull the pressure down. And then once you're doing that, then you're going to move away from it. You can maintain this stretch here, or you can kind of come in and out of this position. What you're doing here is actually mobilizing your first rib. Most people are surprised to know that your first rib is actually way up here. It's right in this space behind your collarbone. And that rib needs to move, those upper ribs need to move in order for you to get a nice, good, healthy inhale as you're taking big, deep breaths. The next stretch that I want to show you is for those intercostal muscles that we talked about on the side of your rib cage. So you can do this in a couple of different ways. You can do it simply by doing any type of up and over head stretch where you're holding your hip down towards the ground if you're either sitting on the floor or in a chair, and then sweeping your arm up and overhead, feeling a nice stretch. You might open your chest up towards the sky a little bit to get a nice good stretch. Or if you're wanting to incorporate it into a full body movement, I'll show you a yoga pose that I actually really love. So you're going to come to your hands and knees. If you have a yoga mat or a blanket, you can lay it out to cushion your knees a little bit. You're going to come to your hands and knees. You're going to keep your left knee down. Bring your right leg out to the side. Your toes are facing forward. Your left hand is going to go to the left side. Open your hips up. And then with your right arm, you're going to sweep it up and overhead like this. You should feel a nice big stretch through your side. As you take nice deep breaths in, you should feel your ribs expand and contract in this area. And you should feel a little bit of resistance as you're breathing here. And then exhale, engage your core as you're coming back down and return to your hands and knees and repeat on the opposite side. The muscles of expiration are a little bit different. In quiet breathing, expiration is, or having your lungs just recoil, is a passive movement. So you're not using a ton of muscle to let your rib cage come back to its neutral resting position. Now, if you're forcefully breathing out, that's a different story. You're actually using a different set of intercostal muscles here, your internal intercostal muscles, which will also get stretched during the stretch we just showed you, as well as all of your abdominal muscles. So in order to have a nice forceful exhale, it's good to have core stability and core strength. But those exercises are for another day. All right, I hope that you found this information helpful. And as always, please feel free to post questions in the comments and I'll be happy to help you. Have a great day.